My name is Judith Daire from University of Cape Town. Thank you for taking your time to listen to this presentation. In this presentation, I'm going to share with you about a study that I'm doing in Mitchell's Plain, which is one of the sub-districts in Cape Town in South Africa. I'm trying to explore what shapes leadership and management practice of primary healthcare facility level managers. It is widely accepted that leadership and management, spread across all the levels, is one of the critical features of well-performing health systems. However, there's less attention given to the leadership and management at the lower levels of the health system. For this reason, there's limited evidence and indeed the practice of supporting lower-level managers in the health sectors of most developing countries. For example, in South Africa, primary healthcare facility level managers are professional nurses by training. They take on leadership and management roles and responsibilities This is because there aren't very many situations where there are well-established ways of supporting professional nurses who become managers. It is for this reason that we decided to conduct a study for us to understand what shapes leadership and management practices of these primary healthcare level managers, and we are doing this by exploring the transition process from being a professional nurse to being a facility manager. And I hope by the end of this presentation, I will have shared with you the methodology and the implications. In terms of the purpose, we're aiming at generating ideas about what sort of support would be appropriate for professional nurses who become managers, and how best to offer this support. These ideas are going to inform support for primary healthcare facility managers in the sub-district where we are conducting this study. At the same time, we want to draw lessons from our experiences in Mitchell's Plain to wider context and audiences. In terms of methodology, we've adopted collaborative action research as an approach, and the design is that of a case study, where we are engaging with primary healthcare facility managers quite intensively through reflective practice. We're using reflective practice as a process of engaging and generating research information. In case you're wondering what reflective practice is, in a nutshell, this is standing back from our routine activities and thinking about our own ways of being, thinking and working. It is believed that this process leads to self-awareness and development of effective ways of being, thinking and working. And you may also be wondering why reflective practice as a method for this study. Well, we understand leadership and management competences, or capabilities if you like, as not just being skills and knowledge, but also about development of a leadership or managerial identity. And as you can see from my slide, there's so many factors that influence the way people practice management and leadership. Therefore, we believe that there's need for innovative ways of investigating leadership and management. And since reflective practice questions principles of actions, we think this is an appropriate approach for our study. And how are we using reflective practice as a research process and method? As I mentioned to you earlier on that I'm engaging with 9 facility managers, we started by reflecting on their individual life stories. I was meeting with them on a monthly basis over a period of 4 to 6 months. They reflected on their background, how they became professional nurses, and how they end up working as managers. We reflected on their critical instance. I provided them with journals in which they were documenting their critical instance from their day-to-day life as managers. And again, I was meeting with them on a monthly basis over a period of 4 to 6 months. Further than that, I collected perceptions of their leadership and management practice from the staff that they work with as well as their line managers. And once I collected the feedback from their colleagues, I went back to the facility managers and we reflected on this feedback together. And in the next phase, we are going to have group reflections with all the facility managers and another group reflection with sub-district and district managers. The idea for the group reflections is to collectively think about how best to offer support for the facility managers in Mitchell's Plain. In terms of the implications, we are hoping that the reflective process that I'm having with the facility managers is going to facilitate the development of their own reflective practice as a managerial skill. And we hope the collective reflections will be a process of co-production of knowledge, which is the ideas for supporting the current and the future primary health care facility managers. In the end, what we hope to achieve is to feed into leadership development program in the academic context as well as in the organizational context. In the academic context, we are going to develop a training program. In the organizational context, we are going to contribute to thinking about instituting a mentorship program in the health system. And from a conceptual and methodological perspective, we hope to contribute to theory building about leadership development and demonstrate a participatory approach for health policy and systems research that focuses on governance, particularly leadership. Once again, I thank you for taking your time to listen to this presentation. Thank you.